Hello everyone, I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the topic which is nothing but the types of stretching. So the stretching is nothing but which helps to increase among the unlock the movement and also helps to enhance the flexibility and accelerate the recovery for the individuals with the diverse physical needs. Uh, So, how and why the foundations for the therapeutic stretching? So, this therapeutic stretching mainly focuses on improving the flexibility and injury prevention, mainly helps in the pain management, finally enhance the recovery. So, stretching helps lengthen the muscles and as well as also increase the range of motion in the joints and among the daily activities and also for the injury prevention. So in injury prevention, the regular stretching can reduce the muscle stiffness and as well as also reduce the imbalance, swelling, and the risk of strains among the musculoskeletal injuries. Final one, it concentrates on the pain management. The targeted stretching can alleviate the muscle tightness and as well as also spasms, contributing the pain relief in the conditions like back pain or the fibromyalgia. And final one, it also helps in enhancing the recovery among the patients, whereas the stretching can improve the blood flow to the muscles, which aids in removal of the metabolic waste products that and speeding up, accelerating the recovery of the muscles. So the stretching is consists of the two different types. First one is static stretching and second one is the dynamic stretching. So now we're going to see about the static stretching. So static stretching involves on holding the stretch for sustained period, typically for the 15 seconds to 60 seconds without bouncing or jerky movements. It performs slowly and deliberately, focuses on elongating the muscle with maximum comfortable length. Next one, the benefits of the static stretching are it increases the muscle length, it enhances the joint flexibility, and it also reduces the muscle soreness. Next, we're going to see about the applications are generally these static stretching we're gonna apply in the sports persons and as well as also the general fitness routines, which it mainly helps in post exercise cool down exercises, rehabilitation for the muscle tightness, and as well as also for the general flexibility improvement. Now we're going to see about the dynamic stretching. The dynamic stretching is the thing but which concentrates on preparing the body for the functional movement. For the dynamic stretching, there is a control movement which helps in increasing the blood flow. It involves the continuous control movement that takes the limbs through their full range of motion. It raises the body temperature and as well as also increases the blood flow to the muscles, preparing them for the activity. And then it also helps in the dynamic flexibility and prepares the body for the specific sports activities. And finally, it is ideal for the pre-activity warm-ups to enhance the performance and to reduce the injury risk. That is also another technique of stretching, which is nothing but the PNF technique. So PNF technique, which is deliberately stands as the uh, proprioceptive neuromuscular facilitation technique. So there are three different techniques mainly focuses in this PNF technique. First one is contract relax, second one is hold relax, third one is the reciprocal inhibition. So this contract relax is nothing but the muscles passively stretched and then the patient contracts it against the gravity followed by the deeper passive stretch. Then second one is the hold relax, the muscle is passively stretched. Then the patient performs an isometric contraction of the antagonist muscle followed by the deeper stretch. Then third one is the reciprocal inhibition, actively contracting the muscles opposite to the target muscle, facilitate the relaxation and stretching of the target muscles. Next one, we're going to see about the ballistic stretching exercise. So ballistic stretching exercise are nothing but the rapid and bouncing movements of stretching, which involves in the quick jerky movements at the end of the range of motion. It uses the momentum to force the limb further into the stretch. The risk of injury is due to the forceful nature, and the ballistic stretching carries the higher risk of the muscle strain and as well as also it tears if it is not performed correctly. So the specific application for the ballistic stretching is mainly used for the highly trained athletes in the sports requiring for the extreme range of motion as well as such as gymnastics and ballet stretchings. So next we have to compare active and passive stretching. So the for active stretching, there is no need for the external assistance. It mainly helps in builds the strength and flexibility, and it is good for the warm up exercise and dynamic movements. In passive stretching, the needs and uses have been the external assistance. It relaxes the stretching muscle, and it is also used for the ideal cool down and the deep flexibility gains. The tailoring the stretch, the prescriptive stretching for the specific conditions, are the mainly stretching is concentrated on the different variety of conditions, but here we mainly concentrate on the four different techniques. First one is the lower back pain, second one is the knee osteoarthritis, third one is the plantar fasciitis, and the final one is the shoulder impingement syndrome. So these are the major and the prominent conditions we have mainly using the stretching exercise to the individual patients. So this is the overview of the stretching in the exercise therapy. So see you on the next video. Thank you.